Hello, and welcome to the Mission Motherhood Show, brought to you by Cheri's Choice. I'm your host, Cheri Bergeron. And each week we explore challenges that ambitious women have navigating their path to motherhood on their own terms. And today I'm really excited to have Dr. Oluyemisi Famuyiwa, which we've been working on that name. I think you're going to maybe allow me to call you Dr. Yemi so I won't mess up your
That's
name
fine.
every time. is that what you go by?
That's fine.
Okay, perfect. Well, I'm so excited to welcome you to the show. Dr. Yemi is a board certified reproductive endocrinologist and a Castle Connolly top doctor with over 25 years of clinical experience. She is the founder and the medical director of the Montgomery Fertility Clinic, an assistant professor at the George Washington University, host of Fertile Talk podcast, and a frequent contributor on women's reproductive health. Um, Today, we're also going to talk about her book, The Quest for Fertility, which is a physician's led guide that goes beyond clinical protocols for patients seeking understanding and clinicians committed to whole person care and anyone who has felt alone in that process. So, thank you so much for joining us.
Thank you for having me.
Yes. So, I I really immersed myself in your book,
Oh,
and
good.
there were a lot of things that kind of were new to me, and I'm sure will be new to a number of the people who are listening. Um, the book starts with a thought provoking quote. It says, "Between science and soul lies the quiet courage to begin again."
That's
And I'm curious why you wanted to start the book that way.
because I think um, fertility is such that sometimes people give up,
Mhm.
right? They just sort of collapsing on themselves and think this could never work. It's a done deal. So it's more like you can evaluate your options. And even if it doesn't work the first time, it can always work again.
That's
You know?
right. And I think that is one of the things is there's never sort of this assurance or this, if I do these things, then I'm going
Yeah,
to end up with a positive outcome. And so I think it can be hard to keep
yes,
hope during
uh,
that process. And that's
yeah,
where the courage comes in, I would expect.
yes. Trying to tell people, I've seen people who've struggled for years and then boom, all of a sudden they get pregnant when they weren't really thinking about it.
Wow.
Yeah,
And you had your own personal experience with
yes.
infertility. And so could you tell us a little bit about that and how that may have shaped the way that you practice medicine?
Um, yeah, I think that because did, I remember when I was in my training as a fellow, you see people who have had problems with infertility, and you never think about it till you're the person, right?
Yeah.
So you're in training and you're seeing patients. All of a sudden, you're like, oh my gosh, I didn't know this many women had problems until you have to deal with that yourself. So it's an eye opening. And not only did I have a miscarriage, I also, it took me a while to get pregnant after that, right? So
Yeah.
you
Yeah.
never think that you're going to have those problems, but you do.
Yeah. And how, I mean, how did that shape now how you practice medicine and how you relate, to these women or interact with them?
So I think that, when you're the one looking at it from the other side, um, I remember when I was a fellow, um, trying to get pregnant and not really getting that pregnant fast enough. And, you never, you take care of patients who have those problems. And then it really brings it home if you have to, or when you're going through training, all of a sudden you're like, oh my gosh, what's going on? All these women can't get pregnant, right? Um, you have to really pause and think about it a little bit. And then I think that one of the scary parts is you see all these women who are young, especially part of my training was in the military hospital. And you're seeing patients who are extremely young, people you wouldn't expect to having to have
Yeah.
difficulties, having those difficulties. And so that is, I think, the first introduction to where you think, oh my gosh, maybe I don't have that much time. Maybe I don't
Hmm.
have the time that I thought I did. Maybe I need to, hurry up and get along with this because you just don't um, have an idea of the time, right? And that's what most people don't understand, that time is not always in their favor, right? Most people
It's
think,
never in our favor. Yeah.
most
Right,
people
right.
think they can just wait, and they are basically, they're not thinking about it. They just
Right.
don't think about it. And sometimes by the time they get to think about it seriously, um, for some women, it may be a little late.
Yeah, and I think you say one point in your book that we take fertility for granted
Absolutely.
because it really is a thing that's so embedded in our culture. And you spent time speaking about that in the book about these cultural messages that women
Yes.
receive about fertility and
Yes.
motherhood, and that is actually a factor in how you practice. Could you
Yes.
share a little bit about how those cultural messages play out for us?
Well, I mean, so when I say culture, different people respond differently to women. And in certain cultures, it's a taboo not to have a child. It's like
Mhm.
taboo. So, and those women, sometimes they're either ostracized, sometimes the husband culturally is allowed to divorce, or, and if they're not divorced, they can marry a second wife, right?
Mm,
And the first wife doesn't have child, well, and he's excused, and sometimes those women sort of accept that, and this has nothing to do with educational level. It's just something that culture demands.
right,
And unfortunately, the blame is usually put on the women. you know
right.
I've had women who were told if they didn't produce any child, they can be let go from the wedding, and they can't really find any recourse from their own family, because that family can turn around and say, well, what do you want, you ungrateful child? He married you up to a great husband. He provided you with everything. You have your own hut, you have this, and what else do you want?
Mm.
Yeah, so people do have to, or sometimes explaining to patients that, you know, through no fault of their own, they may have certain conditions that they may need help with, right? So all those things factor in.
Yeah. And I think even in the United States where maybe things aren't quite so dramatic, they're actually more subtle. And I think women who struggle with infertility or even men who struggle with it, it's a crisis of identity
Yes.
and something where we are fearful that our relationship won't survive
Yeah.
or that somehow we are less than. And I think then we have a layer on top of that if you have ambitious career women that you have worked with who
Hmm.
wait longer and then it becomes a self blame, I
Yeah.
should have done things earlier. And I think you even address this and how self blame is kind of an unproductive
Right.
uh,
And
thing.
also, and that the same goes for men. I think in the book I share numerous stories about men who were dumbfounded when they found out that their sperm was suboptimal. Right? It
Right.
always comes as a shock, like, wow, you know, I'm a bodybuilder, and 240 pounds of solid muscle, and this can't be happening, right? So some men go through the stage where they feel emasculinated, if you will, and it's really hard for them to wrap their heads around it, right? Um, I see, and I do share stories of that in the book, and and the truth is, some deal with it better than others. Some you can help better than others, and for some, it's really devastating.
Yeah.
Yeah.
You have this interesting perspective in the book about the fact that even though we have these challenges, that we're not helpless.
Absolutely.
And there's a quote that you have around this being a reproductive orchestra, and that we are the
What?
conductor of this reproductive
Exactly.
orchestra, which I think,
Yes.
you talk about a symphony of timing, biology, and
Yes.
health. So
Absolutely.
let's talk more about that.
Oh gosh, don't get me started.
Oh, but that's what we're here to talk about. Well, one thing that kind of blew me away was you talk about an unusual prescription that you make, which
Yes,
is for your patients to go and spend an hour in a butterfly garden. So,
absolutely.
what? Tell me what that is.
Well,
What's
I
driving that?
I love nature. I mean, even as I'm looking at you, I'm looking at the trees, and you can see trees on this side. I'm surrounded with windows. There's something that it does that uplifts my spirit. And when my kids were small, I used to. There's this regional park um, close to my old. It's kind of equidistant from my old office and where I used to live, and it's a very busy park. They've got like pony rides, they've got merry-go-rounds, they've got swings, and so the whole neighborhood comes and it gets really noisy, right? But right behind it, there's this grove. It's like you feel like you're almost in a different country, really. So you get this noisy park where everybody is in the park, and then they got a train ride, and then there are a bunch of trees, almost like a forest behind it. And if you walk through those, you got to go through the trees. I feel like I'm, uh, what's that? The Robin Hood going through the trees.
Uh huh.
And all of a sudden, you come out on the other end, right? And it's like dead quiet. You could drop a pin. I don't know if it's a trick of the trees around, but something happens to the sound where literally you step over and it's like you step through a sound barrier. And it's so beautiful. And it goes on for acres, and they have a flower garden that goes on. And, they even have this paved walk, if you're a meditative walk, where you can stops. They have like a mini lake, that man-made lakes in the middle of it, and right in the center of it, they have this enclosure full of butterflies and flowers. And they have the enclosure because they want to keep the butterfly, but it's
Right.
large. It's large, so it's not like they're in a little glass jar. It's quite large, and once in a while you take guided tours through it, and it's so serene and so beautiful. If you ever come back, where are you located, Sharon?
I'm in Austin. I'm
Oh,
in Austin. So,
if you ever come to Montgomery County, Maryland, you have to go. Well, the funny part is, I think in this, at least in this part of Maryland, we have so many parks like that. But this particular one, there is a butterfly garden in this one. It's the only one that has it that I know of in this area.
wow.
It's
Well,
so
but I think so. It's a sanctuary of kind.
yes,
And
exactly.
why is that therapeutic for
Um,
women who are going through this?
I think that you can reduce anxiety and stress in nature. As a matter of fact, I did write an article about this in Medium a long time ago. There's in Japan, for instance, they have something called tree bathing. Are you aware of that?
No.
Yeah, look it up. Shinriko is called it. They do tree bathing where you are allowed to you go through the trees and woods, because you see the trees, they give off, they call them phytonkines, that helps them to fight viruses and bacteria and invasive species, otherwise they'd be dead, right? So that's what they use to survive. Well, when you walk in wooded area and in trees, maybe it's some of that that gets on you. Whatever it is, it's extremely calming, very, very calming. And I used to do that for me, and I
Right.
set my kids up there. So I thought, you know what? Let me suggest it to my patients, and I'd write them this prescription. I said, yeah, here, just go sit. Just let nature heal you for a minute. Just go
Yeah.
sit.
And I
And
think it's also about finding some perspective in life, because when we're struggling with infertility, it feels
all
immersive,
consuming. Yes.
right? Consuming. And
Yes.
so it really is about stepping out of that. So, as what's interesting is a lot of times the focus on women's mental health when you're in a clinical setting
Mhm.
is not very common for doctors. And so it's sometimes it seems like doctors are taught to keep an emotional distance from their patients so that they can have objectivity, and you focus on the tests, the procedures, but you're
Right.
taking a very different approach.
Yeah.
um, and so, and you talk about empathy gaps
Yes.
with physicians, and you even said science without soul is sterile. So it almost seems like you're saying that it's really important for doctors to have this holistic view of their patients for more success. So tell me what's behind all of that, and is your book really
So
a lot trying to guide the other physicians?
as a matter of fact, I gave it to one of my colleagues who's a professor, and I never thought about it. And he said, "You need to reach out to medical schools, and maybe they need to have this on their reading list." So I'm actually gonna. I went to Emory Medical School in Atlanta, so I'm gonna reach out to them, and I do teach medical residents and say, "Hey, listen, just for funsies." And it reads fast, even though it's thick, because there's a lot of white space in there and big letters. But it reads fast, and it's sort of fun, told from a patient point of view. So yes, I do teach a lot of PA students, NP students, GYN residents, and this is part of what I do. It's part of who I am. And part of that has to be with also, I really just enjoy people. My old mentor at NIH told me, she said, "Yemi, you have the gift for God." I like talking to people. I just love, you know, um, interacting with people, getting to know their story. Um, that to me is the fun part of this job. You can't do all science all the time. Um, you need to, have you ever heard the phrase, you cannot pour from an empty vessel?
Mhm.
Can't. So you need something to rejuvenate your soul, to let you see patients, from the way you would, you have to always, this is what I tell my staff actually. Every single patient that calls the phone could be your grandmother, your aunt, your sister, and if they're men, maybe that's your wife, your girlfriend, your daughter. They're no different. So when you see them in that light, how would you want to answer your mother, your
Yeah.
sister? How would you want your nephew or your niece to be treated, right? So you start with that. I mean, of course, there can be challenging patients that will try you, um, and that's with any time you interact with the public. But see it from their side, and you almost change how you approach things.
Yeah, you're personalizing it, and also it's kind of going back to that history of doctors as healers. I mean, but there's that mind, body, and spirit
Mhm.
connection that it sounds like you're striving for with your
Yeah,
patients.
I mean, I do think, the best clinics work with mental health. We have psychologists and therapists that we refer to. And sometimes I encourage patients, I'm like, would you like to talk to someone? I mean, if they
Yes.
say no, fine, I
Right.
leave that alone. But I had a patient once who had repeated miscarriages and confessed to me that she wanted to commit suicide. And I'm like, oh dear Lord, have mercy. I said, you know what? Now that's beyond my encouraging. Would you like to talk to someone? And she did. She took time off. She was seen by psychiatrists and counselors. They didn't really give her any medication, but they worked with her. And she came back to see me 6 months later. She was a different human being. I'm like, wow, what happened? She goes, oh, you forgot you asked me to go get. I said, yes. She goes, I did. And I gained perspective. And it was a different human being. So please, when people, just asking them, would you like to talk to someone about this? You know, yes, I'm going to encourage you, but, I'm not a trained psychologist or psychotherapist or psychiatrist. There are people who are skilled at this
Yeah.
that we work with. And I said, would you like to talk to one of them? And, just ask him for the first, ask their permission, right? And then if they say yes, okay, here are resources that you may be able to use.
Wow. I mean, it can make our mental health can make such a huge difference. I
Oh,
wanted to get into a few of the areas that surprised me in the book about that can impact our fertility.
mm,
You talk about the brain's
right.
role in reproductive health, and I'm like, how how is that? I mean, I know our mindset, but
Yeah.
beyond that,
Uh-huh.
you talked about the hypothalamic
Yes.
dysfunction.
Yes.
Maybe share a little bit. Too much exercise and chronic stress and
Mm,
things like that can have an impact. So, could you
mhm.
share some about
Yeah,
that?
absolutely. Remember, I talk about this in terms of your reproductive system is really like a fine-tuned orchestra. Do you know who Andre Room is? You ever seen his orchestras?
No, not
Oh,
particularly, but I'm familiar
just
with the concept. So,
oh my gosh, he transports you to a phenomenal place. He's got everybody playing their part just right and bringing in the violin when they need to, and bringing in the pipes and then the drums and bringing in the chorus, and all at the right time. As that gives you this rousing orchestral feeling. Well, your brain is that conductor. The
mm,
hypothalamus is that conductor waving you through, right? And it is responsible for sending the appropriate signal to your pituitary gland that's further down the brain, right? Right between your eyeballs. Go like this, where they meet is where your pituitary is. It doesn't function by itself. It needs the signal from the brain. And when the brain says, okay, fire off, sends a signal to the pituitary. Pituitary goes, got it, relay station. Send the signal to the ovary. Start growing the next batch of follicles. Then the ovary sends the signal back to the brain. Here's the estradiol from the growing follicle. Then the conductor says, got it. The follicle must be big enough to ovulate. Second signal to the pituitary. Time to ovulate. Boom. Signal goes to the ovary. LH surge. Follicle pops out. Isn't it beautiful?
it's miraculous. But the thing is
Yes.
that there are things that our lifestyle can do to impact this, right?
Yes.
Positively or
Yes.
negatively. And what
You
are
can,
those things?
if you don't get enough sleep, for instance, and you're not, you know, you can irritate your hypothalamus. We get an inflammatory response around it. It doesn't work as well, right? And you fire off the wrong signals to the relay station, the pituitary gland, right? And we know you're not getting enough sleep, you're not getting enough melatonin. That could affect the eggs as they're growing, and because the eggs, you're born with a fixed number of eggs, but then those eggs, while they're waiting their turn to come out, they're exposed to whatever you're exposed to, whatever toxins you're exposed to, whatever food you choose to put in your body, whatever drinks you put in your body, whatever smoke or particle gets to you, they affect the eggs. And you can try and, sometimes the body tries to help repair some of that damage, right? And your body's natural way of doing that is maybe your melatonin, right? Your body also makes a little bit of CoQ10 that can also help fix some of that damage. Not enough, you may need to supplement after a certain while. But, and then people who exercise so much, you get what we call stress induced hypothalamic amenorrhea, where now the signals haywire and
Mm,
you're not sending signals to the pituitary, you're not sending the signals to the ovary, so you don't ovulate, right? So you need to tone it down a little bit, get back your body metabolism, get you back your body fat composition back up a little bit, so that it can start to beat again, right?
Wow. Yeah, so I mean, it really is about the extremes in which we're living
Right.
our lives.
Mhm.
Too much stress, too
Right.
little sleep,
Yeah.
too much exercise. I saw you talked about also the thyroid, which I have thyroid issues, and you said that this is often one of the most underdiagnosed things, and
Yes.
that women with thyroid disorders are 3 times more likely to struggle with infertility. And it could be too much thyroid
Or
or
too
too
little.
little thyroid.
There's a sweet spot for it. You know, think of your thyroid as a spark plug, right? And it needs to function right for the main engine to work, right? And if the spark plugs off, everything stops working. So if you're not making enough thyroid hormone, the brain, the pituitary gland, again, controlled by the hypothalamus, is going to think, you need to make a lot more thyroid hormones. So it revs up your thyroid stimulating hormone to exceedingly high levels. If you have too high levels of those, that can interrupt the pathway, the hypothalamic pituitary ovary axis. Then you start to have issues. Now, if you don't, so that's because you're not making enough thyroid hormones. So you could easily stop ovulating because of that. Now, on the other hand, if you're making too much, right? Your heart rate goes up, you get almost a toxic effect of that. Your heart rate needs to be slowed down. That can also feedback inhibit the same axis that we talk about and disrupt that nice signaling hypothalamus pituitary ovary as well. So, and we do know that people who have abnormal thyroid, if they have thyroid disease, they are also at slightly higher risk of increased incidence of miscarriage, right?
Yeah.
So if you're having repeated miscarriages, it's an easy fix, right? It's an easy fix that if you make that diagnosis, you can easily. I'm not saying it's very common or it's the most common thing, but it's such an easy fix that to ignore it um, is just an oversight, really.
Right. I mean, it's something that maybe not all doctors think about as the first thing, because it's all about your reproductive hormones, it's all about the anatomy and things like that. And so I think that's a great call out.
Right. I
Um,
think most fertility doctors are aware and they know to look for that. Yeah.
okay, good. Well, I think even then, before someone's going to fertility doctor, then that's something to talk to your physician about, your
Absolutely.
thyroid. Yeah.
Yeah. Yes, absolutely.
And you talk a lot about weight and diet as
Hmm.
being some of the things that impact things. So I
Hmm.
read in your book, it said that non-obese women under the age of 35 who closely adhere to a Mediterranean diet
Hmm.
had significantly higher IVF success rates.
Hmm. Yeah, there have been articles that have looked at those types of patterns that have showed that there may be some benefit and what is that really? You're eating vegetables, you're eating fruits, you're eating nuts, you're eating berries. What do they have in common? They have antioxidants that can help improve your quality. But more importantly, we're now finding out that those type of diets help to improve your gut microbiome. And we now know that the gut microbiome, believe it or not, can also influence fertility, right?
Wow.
We didn't used to know that. That's all stuff coming out. And we now know your gut microbiome can also affect your vaginal, your uterine microbiome as well,
It's
right?
all interconnected so
It's
much.
all, yeah, it's all connected. So, and I tell my patients, you adopt a healthy lifestyle, and what's the worst that can happen? And you live
You
a,
get healthier. Yeah.
you get healthy.
Well,
Yeah.
one thing you said that was interesting was you also said that too little fat is a bad thing, like
Yeah.
a super low fat diet, that
Mhm.
you need healthy
You
fats
need a
and things like that.
composition because you do need healthy fats to help make steroids, right? You need the fatty chain. You need to make healthy steroids. After all, your estrogen, your testosterone, those are all steroids, right? They're steroid hormones. So you need a healthy amount. So overtly, you don't want to totally eliminate the healthy fat. Keyword healthy fats. So
Sure.
healthy fats like you might find in avocados, for instance, your
Sure.
omega-3 fatty acids in salmon, in certain nuts like cashews and stuff. Those are all healthy, right? So there's nothing wrong with that.
Then, you talk about some things like marijuana is a much more
Aha.
common
Mhm.
thing that people are, because it's been legalized.
Yes.
Is that an issue when it comes to fertility?
Yeah, because now we see there are numerous studies that have come out now that have shown that marijuana and cannabinoids can have an influence on semen parameters, right? And albeit it may be reversible, but we're seeing that, right? And sometimes the effects can linger for a few months after the habit is stopped. So I do encourage my patients while we're trying to get pregnant, if you could abstain, that would be nice. And then there are other studies, although these are more observational, that said that women whose partner regularly consumed marijuana had a higher incidence of miscarriages, right? They didn't have to smoke it themselves, but they had to be around someone who did.
Wow.
And we now know that vaping has heavy metals and all these other things in the fumes, and that also has been shown to have a detrimental effect. These are things most people never think about. So the way I look at it is, look, Cheri, it's hard enough to get pregnant. Why make it harder?
Sure. Yeah, no, absolutely. Now, then you talked about manicures and the timing of
Yes,
manicures.
yes,
Okay,
yes,
so I'm all about the good nails. So, and
yes,
and you didn't say you can't have manicures, but there's something around timing. So maybe
exactly.
share some about that.
Sure. So actually, if you look at the literature in Europe, certain gels have been outlawed, I mean, banned outright, right? Because they found they may have some toxic effects. But what I refer to is we do know from several studies that and these are actually studies where they looked at things like people consuming fruits or something like that and then tested them for chemicals at different times of the day. And they found that, you know, you eat whatever fruit you like to eat, so they're not regulating whatever it is. And then they test residues of insecticides or pesticides, and you find out in the morning those things are cleared. You don't have a high concentration. In the evening, it's higher. Why is that? Because your liver has a rhythm to it and is more active in detoxing you at certain times of the day. Whereas at nighttime, it rests. So when you're exposed to toxins inadvertently, if you're exposed in the morning, your body has a better chance of fighting it off versus if you're exposed in the evening. And they have shown observational studies that nail salon workers tend to have issues with fertility and
Mm,
success rates, right?
wow.
So those people need to work in well ventilated environments, maybe get, you know, one of these filters that can filter out um, um, volatile organic compounds. So my take is, yeah, if you want to do your nails, do it, sometimes earlier in the day or somewhere well vented. And if possible, avoid the TPO gels. They're not saying all gels. They actually did single out a specific ones. And you can ask your nail person which one are they using and try to opt for the one that doesn't have this toxic gel.
Right. Wow. I mean, there's so many things to think about.
Yeah.
How do you, so I know there could be people thinking like, it's everything. Oh my gosh, what
Mhm.
do I
I
have
know.
to? And
Yeah.
then, and then, in your book, you also talk about good supplements and bad supplements. So
Right.
I'll refer people to the book for
Right.
those kinds of things because not all supplements that people
Exactly.
are making are good, right?
Yes. Yes. Absolutely. I've had people call me up and they say, "Oh, I saw on TikTok shop and I bought this," and I'm saying, "Well, let me look it up for you," and then I send them articles. And then some of these things that are not necessarily regulated, you don't know where they are produced. So there could be contaminants of heavy metals. You're not there to quality test it. So if they have heavy metal contaminating it, you're consuming whatever herbal concoction that you don't know the ingredient of. And another thing is people will sell you homemade creams or um, I forgot that there's one popular one, cocoa butter or whatever it is, and they'll put the word fragrance
Mm.
that make it smell. Well, what is that? It's a volatile organic compound. So unless they're telling you exactly what fragrance they put in, I would avoid it because you don't know. Now,
Yeah.
if it's a properly regulated manufacturer, they should be able to tell you exactly what they put in it. But if you just hear the word fragrance, your antennas should be high.
Yeah. Yeah, and there's so much in the book about that,
Yeah.
and I think one of the most important takeaways here is to really work hand in hand with a physician that can
Yeah.
help guide you to
Yes.
what because there can be some desperation involved and like
Exactly.
whatever I can find, but that's not always helpful, right?
Yes. Absolutely. Absolutely.
And and
Seek help.
And so, one of the things you talk about is the importance of getting a fertility assessment.
Uh-huh.
When do you think that women should get a baseline of their fertility?
Yeah, excellent. So anyone under the age of 35, we always say if you've been trying for a year, go get help. If you're over the age of 35, 6 months is the cutoff, except for one caveat. If you have PCO, polycystic, why not no longer PCOS, polyendocrine metabolic ovarian syndrome nowadays it's called. If you have thyroid issues, if you have endometriosis, or you've had chronic pelvic pain that they haven't really pinpointed why, then you might not want to wait too long. Those group of patients, you want to get help earlier,
Yeah.
right? And have
Irregular periods, even things like that, right?
regular. If your periods are not regular, please don't wait a whole year. Please go get in because you may be now what we call PMOS, polyendocrine metabolic ovarian syndrome, or you may even be having thyroid issues because those will give you irregular cycles, or you may be having an elevated prolactin, and if it's high enough, one of the ways they'll show up is irregular cycles. So don't assume, oh yeah, my cycles have always been that way. No, no, don't take that.
Interesting. And what about egg freezing? You know, when we're talking about
Mm,
women
mm,
being really proactive
right.
with their fertility and
Mm.
preserving their fertility, what do you think is like the optimal age for women
Sweet
to
spot.
freeze their eggs?
Sweet spot, late 20s, early 30s.
Yeah.
20 to 32, sweet spot.
Okay.
Sweet spot.
I mean, earlier than many women think.
Absolutely. Because you start to see a precipitous decline in both quantity and quality around age 35. And
Right.
the decline of quality, not necessarily quantity, also takes a sharper decline around age 38.
Right.
So it's one thing to get the eggs, but having the eggs doesn't mean that you're going to have a good outcome, right?
Right. And I think the assessment and the freezing kind of go hand in hand because what if your biological clock is ticking faster than than
Absolutely.
average?
Absolutely. We have patients who have premature ovarian failure, right? We used to call it premature ovarian failure. We now call it premature ovarian insufficiency. And I see that a lot, right? I talk about several women who had that in my book.
Yeah. And so, what do we need to do to create more balance? I know you talk about taking control, and I think you mentioned something called your seed method.
Yes. Seek knowledge, empower yourself, right? Know your options. And then when you know all this, you can now dedicate yourself to whatever you need to do. right? So ignorance is not bliss in this instance.
Right.
Just get
Right.
answers. So, like I tell patients, the worst that someone could tell you looks like everything is peachy keen. You know, we can check back again in 6 months or a year, but at least start getting that testing done. Do you know if you even have enough sperm? Do you know if anything's wrong with your sperm? Do you know if you're having premature ovarian insufficiency that hasn't shown itself up? Do you know if you have, elevated insulin that's causing havoc in your body somewhere, right? So, do you know if your thyroid may be compensating, but it's really out of whack? And the reason you don't have symptoms is because now your body's overcompensating for certain things. So, seek information to empower yourself, right? It's your body, your journey. And then when you know, you can now say, okay, this is my choice to do A, B, C. You're making a choice. And if it's your choice to wait a little bit, there's nothing wrong with that. But
Sure.
you're sitting in knowledge.
Right. So seed is seek understanding,
Hmm?
evaluate your options,
Right. Empower
empower your decisions,
and dedicate yourself.
and dedicate to your journey. That's amazing. Well, what additional guidance, is there anything that you would give to women who are, they know they want to be mothers one day, but
Yes,
they're not really focused on this at this time?
exactly. Yes. And actually, that's one of the reasons I wrote this book, Cheri, because I see a lot of patients in their 40s. I'm like, oh my gosh, what do I wish you knew when you were 20 something? And
Yes.
if I could go back in time, what do I want to give you? My book is this gift to you so that you know, the people in their 20 now, whatever doctor you have when you're 40s will say, well done, you took care of this angle. People have no clue and they go, I don't want children. Well, you may not want that right now, right? Maybe you'll change your mind. But I'm saying at least know what's in the realm of possibility. Know what's in the realm of what could affect you. And you may choose to do certain things differently. Again, it's your choice.
Yes.
Nobody's forcing on you. You don't want to wait till your chances are snatched away from you, right? And then you have no say in the matter.
Right. It is all about taking actions that maximize the amount of choice and options that you have.
Exactly, exactly. That you just hit it on the head. That's exactly it. This is my gift to every young woman out there. I'm telling you.
I agree and I love it. Well, Dr. Yemi, thank you for the work that
Thank
you're
you.
doing. Thank you for looking at us and seeing us as whole people and wanting to connect with that whole person and focusing on our well-being as well
Thank
as our medical stats and numbers,
you.
Be sure to check out the resources on Cherie's Choice to help become a mother on your own terms. I'm going to include some of Dr. Yemi's information there.
Yes.
Again, this is Cheri Bergeron, and I would leave you with this. Remember that if it is your desire to become a mother, and if you feel that that's part of your purpose, you absolutely can. With
Yes.
knowledge, determination, courage, and a village that loves you, anything is possible. So
Absolutely.
until next time.